An inconsolable mother brings her 2-year-old son to emergency room after finding a large amount of bright red blood in his diaper an hour ago. She states that for past week he has been having crying fits while curling his legs towards his chest in a fetal position. The crying resolves either after vomiting or passing fecal matter. Currently, the child is in no distress. Physical examination, including abdominal palpation, is unremarkable. X-ray of abdomen is normal. Temperature is normal. Basically, vitals are all normal. Birth weight and height is normal. Red blood cells, hematocrit, hemoglobin normal. WBC normal. Mean corpuscular volume normal. Which of the following is most likely etiology of his condition? Failure of vitelline duct to open, failure of vitelline duct to close, problem with bilirubin conjugation, problem with bilirubin uptake, or increased antimitochondrial uptake. Next one, this one. Can you quickly type the diagnosis over here? So this baby has come to the clinic, and the mother says that he's having severe abdominal pain, and then after that he tries to kind of curl his legs, passes bright red stools and all that. So what do you think is diagnosis over here? No, diagnosis is not Meckel's diverticulum. I'll point the important features again. So this patient is having large amount of bright red stool, crying a lot due to abdominal pain, and there is how do I say that? There are fits of abdominal pain. Basically, there is abdominal pain, then there is not abdominal pain. And while there's abdominal pain, this patient curls his leg towards the chest in fetal position. And once he has either vomited or passed fecal matter, he doesn't cry, the pain goes off. So what is the diagnosis here? Yeah. So basically, intussusception is telescoping of the abdominal, of proximal gastric, proximal intestine and distal part. Basically, the intestine go inside the distal part, and whenever and after some time, it goes back to its position again. So it can move in and out, in and out. So whenever it goes in, what happens is this part get obstructed. Not only does it get obstructed to the material, but blood circulation is also affected in this part. So what happens is that there is colic, there is pain, there's decrease in blood circulation, there is ischemic pain. So baby starts crying, and while crying, what it does is the baby tries to take its leg towards its abdomen, um, in a fetal position. If I can get an image. No. So basically, the baby tries to cry, tries to take leg towards the chest, and once the colic is gone, once the intestine has come back to its original place, the pain goes away. And since there is all this ischemia around the intestine, the epithelium also sheds away, and it is present. It is then seen in the stool as a red currant jelly stool, a very specific feature of intussusception is red currant jelly stool. Okay. Now, for intestine to telescope inside the in sorry yeah for intestine to telescope inside the other part of intestine, it is important that there should be some leading point. What we mean by leading point is that there should be something inside the intestine which is pulling the intestine inside the other inside the distal intestine, which is pulling the proximal intestine inside the distal intestine. So usually one of the most common leading point is Meckel's diverticulum. So Meckel's diverticulum pulls the proximal intestine inside the distal intestine. Another common cause is lymph nodes. If there are enlarged lymph nodes inside the intestine, they will try to pull the proximal intestine inside the distal one. Lymph nodes get enlarged, maybe let's say in viral disease, if someone is having viral gastrointestinal infection, maybe due to rotavirus. In that case, lymph nodes might enlarge, and they might act as leading point. In our patient, there is no option which points towards lymph nodes or any infectious cause, but this option surely points towards Meckel's diverticulum. So basically, in Meckel's diverticulum, there is this diverticulum due to due to lack of closure of vitelline duct, and this diverticulum causes the pulling of proximal intestine inside the distal one to to cause intussusception. So is this part clear? Do you get that the diagnosis over here is intussusception, and the intussusception is caused due to Meckel's diverticulum? So let's assume this is intestine, and this is our Meckel's diverticulum. Okay, this diverticulum out of intestine. Now, let's assume that I'm eating food and food is going like this, good and nice in streamlined pattern. Okay. Now, this sometimes this the gastric content, sorry, the intestinal content or something like that will get deposited inside the Meckel's diverticulum, and it will also, so basically it will also get pulled along with the gastric content every time. Let me Okay, okay. So every time this diverticulum will also get pulled with the gastric content towards the direction of the distal duodenum. And sometimes while pulling, what will happen that this might go inside the intestine, and along with the diverticulum, it will take this proximal part of intestine as well inside the distal part of intestine. I hope that this was a bit clear how this occurs.
Thanks for watching. Please give a thumbs up and subscribe for more.